So one thing I see quite often among nurses prepping for the CPHON exam, or even nurses who care for patients with sickle cell disease, is they can usually recognize vaso-occlusive crisis and acute chest syndrome. But when it comes to some of the less common acute complications, it can be harder for them to identify what the complication is and what's actually causing it. So let's walk through a quick test question. A 5-year-old with sickle cell disease presents with fatigue, pallor, tachycardia, enlarged spleen. Lab results show hemoglobin of 5.2, reticulocyte count elevated. Which complication should the nurse suspect? So with aplastic crisis. So when you see aplastic, think hypoplastic. And this is when the bone marrow is not producing enough red blood cells in patients with sickle cell. So the clue that would give it away here that it's not aplastic crisis is that in the question stem, the patient's retic count is elevated. Retic count is elevated because the bone marrow is working harder to produce more healthy red blood cells. So for patients with aplastic crisis, we would actually see decreased retic count, not elevated. So because of that, A is going to be incorrect. B, splenic sequestration crisis. So splenic is the spleen, sequestration, think trapping. So this is when the red blood cell is trapped in the spleen. So for sickle cell patients, the spleen is a common site of red blood cells to be trapped and destroyed or undergo hemolysis. Here we see signs of anemia with the fatigue, pallor, tachycardia, the hemoglobin level. Also, we see an enlarged spleen due to trapping and an elevated retic. So the bone marrow is trying to compensate for the anemia. So because of all this, we're going to hold B. C, iron deficiency anemia. This does not cause acute splenic sequestration or what we're seeing here. So we'll cross off C. And D, vaso-occlusive crisis. This is characterized by pain, not by acute splenic pooling or trapping. So for CPHON and clinical practice, I want you to remember, if you see severe anemia, enlarged spleen, elevated retic, think splenic sequestration crisis in these patients. So I hope you found that helpful. Follow for more pediatric hematology, oncology, nursing education, and CPHON exam tips.